we're in this era. It's a very exciting time for precision, personalized treatment advances where we can really pinpoint the specific mutation targets for a particular tumor and develop a drug that targets exactly that mutation, or even use the patient's own cells to develop immunotherapies. And so these are all advancements just in the past 5 to 10 years, and it's very exciting. Unfortunately, to really understand how well these advancements and these treatments work, we need representation from all segments of the population, right? And most of these treatments have been developed and tested within these clinical trials, as you're mentioning, in Eurocentric populations, so in white European populations. So we don't really have the data to know how well these advancements and these treatments, these targeted precision treatments, will work in different racial and ethnic groups. And not only that, a lot of these treatments are based on genetics. And so people of certain genetics, whether it's inherited down from from their ancestors over generations, or that may have sort of developed in response to some environmental environmental stressor, those genetic factors we know can differ across different racial and ethnic groups. And so some of the tumor markers that we have targeted treatments for today are based on studies that are based on genetics of very specific population groups, again, white populations. So, I think what we really need is better representation of Asian Americans across all the different Asian American groups in these types of clinical trials, so that we can make sure that the genetic factors that we're identifying are relevant, and the targeted treatments that we're testing are relevant to our populations and our communities. I think, and this is speaking both from my experience as a researcher, but also my experience as a first-generation Taiwanese American, I think that there are two reasons. One is that the topic of cancer is still very stigmatized. It's a taboo topic. Families and friends and communities don't like to talk about it. And as we may know, that and we still see that to this day. And it's not even uncommon sometimes to hide a diagnosis from the patient themselves. So I think that's one thing. When I first started out my research career, I published one of the first studies looking at breast cancer patterns among Asian Americans, and I received an email from a community member in New York City, Chinatown, in Midtown, and I still remember it to this day. She was a younger Chinese American woman, and she said that when she herself was first diagnosed with breast cancer, she was shocked because the narrative that she knew of was that breast cancer is something that only affects white women and is something that only affects older women. She's neither white nor older, so how is she getting breast cancer? She started talking about it, her disease, her diagnosis, with her community, and when she started to do that, she was shocked to learn that so many other young Chinese American women were also being diagnosed with breast cancer. They just never talked about it. And so there's a sense of, I think that stigma and that taboo creates a sense of the fact that it's not a problem in our communities. So I think that's one thing. And I think also the second reason, potentially, I think is that our culture tends to be very private about medical issues. It's really only shared on a need-to-know basis. And so I think that, coming out and participating in a project, even though all the information that participants provide to us is anonymized, we never report or disclose any data for specific individuals. But I think providing the kind of information that we ask and putting yourself out there, I think is very difficult, and it is asking a lot, especially if as a culture that's not something that we're used to doing.